Hi, my name is Siún. I'm a third year student and I'm studying pharmacy in the UCC School of Pharmacy. Pharmacy is a scientific degree. It's within the area of health and medicine, and because of this it leads to careers in both community pharmacy as well as in hospital settings, and there are also opportunities in industry as well as in management. For this reason it's a great degree to have for people coming into the working world. It gives us great opportunities to work, whether you're interested in working with people, with working in a factory, working with chemicals. It's a very broad degree which will facilitate all of these career paths. Because it's in the area of health and medicine, it also appeals to people who are interested in caring for people, who like to work with people, but equally those who have great aptitude for science or chemistry in particular enjoy the degree course. So, in order to make medicines, we need to understand firstly a lot about chemistry. Professor Anita Maguire is here to explain more about that.
For students coming to study a subject like pharmacy, they get an absolutely outstanding overview of many different areas of science and their applications to medicine. Students coming into the pharmacy programme usually see their career progression as being essentially moving into a community pharmacy role, because that's the role that they're familiar with before they come to university, and of course many of our graduates do move in that direction. But there are also many other areas open for pharmacy graduates, for example working in hospital pharmacy, where they're working together with consultants in terms of optimising drug therapies for patients, working in industry, particularly in the pharmaceutical industry in Ireland, which is one of the most important industries in the country. And there are very exciting and different roles that pharmacists can play in many environments. And of course, in addition, pharmacy graduates may often end up in research and developing careers in the academic environment. If you consider the process of development of pharmaceuticals for drug use, you can almost break it down into a number of large areas. So pharmaceutical chemistry, which is the area that I head up, is essentially at the start of a very complex and very diverse process. But all of these elements of the equation are absolutely essential for delivering effective pharmaceuticals and treating various diseases. In pharmaceutical chemistry at UCC, I suppose our objective really is to give them clearly a rigorous understanding of the fundamental elements of chemistry. That's absolutely critical. They need to understand the link between the structure of the compound and its biological activity. So what is it about the structure of this particular molecule which means that it's an effective treatment for asthma? So the students spend a lot of time in the practical labs undertaking experiments, learning the key techniques involved in synthesizing and analysing compounds. I suppose one of the challenges really is to make sure that at all times that students appreciate the link between the chemistry they're learning and how that fits into their career as a pharmacist down the line. The building that we're in here, the Cavanagh Pharmacy building, was opened in April 2006, and it's a state-of-the-art facility for all aspects of teaching and research. We've been lucky that we've been able to bring on board outstanding staff and outstanding students, and the outcome of our work will really be the students in the future. So I would encourage any student who's considering a broad undergraduate education in an area of relevance to pharmaceutical or biomedical developments, certainly a degree in pharmacy is well worth considering.
Making the active drug substance is part of the story. Equally important is the preparation of a usable drug form to be distributed to patients. So let's listen to Professor Katrina O'Driscoll, who's going to talk about this subject area, pharmaceutics.
The next step then in the life of a drug is how do we get it into a patient? And we call this drug delivery. And this is a separate subject that you will learn about in your pharmacy degree. Now, when we talk about delivering drugs to patients, we can talk about giving them by different routes of administration. For example, we could give it by the mouth, oral administration, or we could give it by injection into the muscle, or we could apply it to the surface of the skin. As a pharmacy student in the pharmacy course, then you will be taught all about how to manufacture different dosage forms and how the manufacturing process should be carried out. And these are unique skills that are taught to pharmacy students. And they are vital skills for employment in the pharmaceutical industry. The kind of research that we are involved in is quite wide. So for example, we're interested in cancer therapy, where our delivery system releases the drug and targets the drug only to the diseased cells and avoids the healthy cells. And in that way, of course, we can cut down on the side effects of the drug. The other area of research that we have is into nanoparticulate formation. making drugs into very small nanoparticles, and the advantages of that would be that they get taken up into cells in a more efficient way. We can also make them so that they release the drug at a specific rate. We also are involved in a pharmaceutical biotechnology, so we're talking there about very exciting new therapeutics that will come on the line perhaps when you're qualified in the next 5 or 10 years.
Pharmacists need to know how drugs work within the body. This subject area is known as pharmacology, and here is Dr. Cryan to explain.
So pharmacology is the study of how drugs act in the body, and these can largely be broken down into two main areas. One, we focus on what we call pharmacodynamics, how the drug interferes with different systems within the body, and two, pharmacokinetics, and that's more how the body interferes with the drug. In the early years, we introduce some of the key themes in pharmacology and teach a lot about the molecular pharmacology. Now, molecular pharmacology is really trying to understand where drugs act at specific sites in cells. And then in the third year, we go into systems pharmacology and clinical pharmacology, which is talking about the whole body and how these drugs act at the whole body system to exert their effects. In the final year, we cover some aspects of veterinary pharmacology as well as advanced pharmacology and drug discovery. We have a large neuropharmacology research group which is interested in how drugs affect the central nervous system, and then we have an immunopharmacology group which is also interested in vaccine delivery. It's important to understand that pharmacology is not a discipline on its own, that we need to interface with our colleagues in chemistry who make the drugs, our colleagues in pharmaceutics who help to formulate the drug, and our colleagues in clinical pharmacy who teach our students all about where the drugs are appropriately dispensed. In pharmacology, we also teach to the medical students and to the dental students, as well as many modules to science students, especially chemistry students.
In a clinical setting, pharmacists need to know how to dispense medicines, about drug interactions, and how to listen to and counsel patients. We caught up with Professor of Clinical Practice Julia Kennedy in our model pharmacy.
Clinical pharmacy actually pulls everything together, which is why it occupies the larger part of the final year. And what you're doing is that you're pulling the chemistry, the formulation, the physiology, biochemistry, immunology, all into one patient. So allowing people to counsel the patients on how to take medicine is a very important part. Pharmacists are ideally placed to be able to monitor patients. They all have consulting rooms where they can have private consultations now. There's a lot of over-the-counter prescribing for minor illnesses. There's a lot of referral for major diseases. Somebody might come in with a fairly innocuous sounding symptom, but through their education, pharmacists would be able to pick up that this is something that needs to be investigated, and investigated, say, fairly quickly. Hospital pharmacists tend to work much more in a multidisciplinary team than you would do in community pharmacy. The patient is the main focus of all their interactions, and obviously with dispensing, which they do in the first, second and third year, that all has to be accurate. Their function is to make sure that the right patient gets the right drug in the right quantity, dose, and at the right time, and for the right duration.
So yes, pharmacy is a very academically challenging course, but there are lots of other positive elements to student life in UCC. The Pharmacy Society, which is involved with the School of Pharmacy, organised several events throughout the year, including the Pharmacy Cup, which has us all out playing sport, soccer and rounders. In general, my UCC student experience has been terrific. I've made some of the best friends that I have through my course. And if you'd like to learn more, please go to the link which is at the end of this film.